Hello and welcome to our special show, Living Long and Healthy with COVID Vaccination. This show seeks to address any doubts, any concerns, any queries that you might have regarding the COVID vaccination. Because remember, the risk of the COVID infection is very real when the second wave cases are rising, and vaccination is the only way that you can protect yourself and the only way we can get out of this pandemic. Well, we have with us experts to address any concerns, any questions that you may have regarding the vaccinations. We're joined by Dr. R.K. Aran, a consulting physician and cardiodiabetologist at the Dr. Aran's clinic in Meerut, Dr. Nihar Mehta, consultant cardiologist at the Jaslok Hospital Research Center in Mumbai, and Dr. Rajeev, Rathi, a senior interventional cardiologist at Max Healthcare, New Delhi. Thank you so much, doctors, for taking time out and answering all the questions that we have. Right, Dr. R.K. Aran, I'd like to start with you. You know, the vaccines have been developed in a very short space of time. It's been quite incredible, actually, within a year to have these vaccines in place. But the question that we get from a lot of people are whether there are any side effects from the COVID vaccine.
We should understand that all medical interventions, including drugs, vaccines, and surgery, do have some side effects. And COVID-19 vaccines are no exception to it. But we must remember that COVID-19 vaccines can never cause COVID-19 disease. They do have some side effects which are generally uncommon, very minor and transient in nature. They don't need hospitalization and can be easily managed by symptomatic treatment like paracetamol, etc. The side effects of COVID-19 vaccines are generally in two forms. One, at the local site in form of mild pain, rash, itching, or a small node, which we normally call as corona harm. And second, constitutional symptoms in the form of mild headache, body ache, chills, low-grade fever, or vomiting. Very rarely, 1 in 5 cases out of million shots, COVID-19 vaccines can give rise to a serious allergic reactions, which we call as anaphylaxis. This is characterized by restlessness, breathlessness, fall of blood pressure, and collapse-like state. This occurs generally in the first half an hour after the administration of the vaccine. And that is the reason you are asked to wait in the waiting area for half an hour. Remember, after having given 8 crore vaccine shots, we have not had any single death related to COVID-19 vaccine in India.
All right. Well, if we come to the subject of children, and you know, schools have really suffered for children in the last 1 year with them having to miss out on physical school. So the question again, Dr. Nihar Mehta, this is to you, that many are asking about COVID vaccines for children.
Yeah, this is a very, very important question because, you know, India has 26% of the Indian population is below the age of 14. And if we ever want to achieve herd immunity, we have to vaccinate the children because they form 26% of our population. But we also have to realize that children are not small adults. They are very different. We have to check for much higher safety values when it comes to vaccines for children. Their immune system is different. Association with the other vaccine that they regularly take is different. And we have to understand that COVID affects children in a very mild manner. Because it's impossible to say which child will react seriously to COVID, they still require the vaccine, but only when we are ensured that the risk of the vaccine is very, very low. Now, as of now, Pfizer is the only company which has a vaccine above the age of 16, but no company has tested vaccines in children below the age of 18. Although most of the companies like AstraZeneca and Covaxin, they've all applied for getting their trials in children between 12 and 15, between 6 and 11. So hopefully by the end of this year, we'll have some more clarity on whether it's a safe vaccine for children. But once the safety is ensured, we must make sure we vaccinate our children so that they don't get it. If they get it, it's not going to be too severe. And most importantly, they give us herd immunity and they prevent spreading it to the other adults and elderly in the house. So we must do it, but only when the time is right.
Dr. Rajeev, Rathi, now this is a bit of a personal question for me as somebody who's had COVID last year. If one has had the disease, should one still get vaccinated?
Anyone who has suffered from COVID must take a vaccine, and it is not a contraindication for them. And the second thing, suppose someone has developed COVID infection recently, then after how many days he should take vaccine? That is again an important question. So once there is a resolution of symptoms and patient has passed 14 days, then he should take vaccine. One more thing, if somebody has taken a plasma therapy for COVID infection, then they should wait for 90 days. So one thing is very clear, even after COVID infection or COVID disease, you are supposed to take vaccine. That is one very important. Second, if somebody has recently developed COVID, then also he can take the vaccine, but the resolution of symptom, there should be a difference of 14 days should have passed. And if somebody has received plasma therapy or any immunoglobulin for treatment of COVID infection, then they should wait for 90 days.
Dr. Aran, now will a COVID vaccine change the DNA? Because this again is some sort of fear people have, and I think I blame that a bit on WhatsApp as well. But tell us about this DNA question.
This is a very common question in the mind of especially enlightened people who have a working knowledge of biology. When they learn that vaccines are created out of genetic engineering of the viruses, they are afraid that it can affect their DNA. But let me tell you, this fear is absolutely unfounded, because DNA is situated in the nucleus of the human cell, which is in the central part, and it's like a sanctum sanctorum where nothing can reach. Actually, none of the particles of the COVID-19 vaccine can ever reach the nucleus and affect the DNA. So the answer to your question is a resounding no.
Dr. Mehta, also if we talk about, blood pressure lowering medicine or lipid lowering medications, a lot of questions regarding how those may affect the vaccine.
So again, it's a very straightforward answer like the last question, because people who take their vaccines, it should be very clear that on the day of the vaccine or before, they need not change or stop any of their medications. The only exception is some medications which are associated with our joint pains and rheumatological conditions, in which case they must talk to the doctor before they discontinue or change their medications. But for blood pressure, sugar and cholesterol medications, there's absolutely no need to change the medications. Being a cardiologist, majority of my patients are on one of the medicines we are talking about, and not one of them I've asked them to stop it, because it's absolutely not required.
All right. And now with cases rising again, restrictions are there in place and people have been asked to stay at home. Dr. Rathi, I'd like to ask you, what are the drawbacks of, being in isolation or long working hours on heart health?
Yeah, that's a really very disturbing thing. If you confine anyone in isolation, that affects their mental status, because we are a social creature. So unless you have got people to talk to them, and if you have got someone to whom you can discuss, or if you are not able to see your colleagues or your family members, that disturbs you, and that results in depression, and that results in a rise in blood pressure also, and that results in irritability. So this is a very disturbing thing. Thankfully, with the help of social media and the devices like smartphones, iPads, tablets or computers, to a great extent, we are overcome this problem. And it is especially true in metro cities where flats are small and you have got limited space, and you have got rooms where you don't have a proper windows or a place from where you can see outside. Then it becomes a very difficult scenario. And once you know that this is a 13-14 days time which one has to pass, we are able to manage this situation. And majority of our patients, they completed their isolation without much trouble. But we have to take a very close watch on blood pressure and sugar, because activity is less, and if there is a irritability, then blood pressure may go up.
All right. So for once, doctors telling us to increase our screen time and use it to help us in our periods of isolation. Well, we'll slip into a short break here and we'll return with more questions and queries that you may have regarding the vaccination. Stay with us. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccination. And we have doctors with us who are answering all your doubts and all your questions regarding the vaccines. Dr. Nihar Mehta, I'd like to go across to you next. And as a heart patient, is there anything that they must watch out for after getting the vaccine?
Well, heart patients are especially vulnerable to COVID. Although we all believe that COVID is a respiratory virus, it affects our lungs. Having worked in COVID for the last year, we realize that at least 15 to 20% of our patients develop some kind of heart ailment, either related to heartbeat abnormalities, clotting abnormalities, heart pumping abnormalities, blood pressure changes. So it's very important that patients who have pre-existing heart problems, whether they are blood pressure or cholesterol or diabetes, or whether they are actual heart problems like patients who had a stent or a bypass in the past, or they have weak hearts, they should all take the vaccine, because the vaccine will prevent that patient from coming to the hospital, even if he lands up getting COVID, and it will prevent serious COVID. So every cardiac patient should definitely get the vaccine. Second point in this matter is that they need not stop their blood thinners, because that is again a question which all our patients ask. No need to stop the blood thinners before the vaccine or after the vaccine. So by and large, all heart patients should, without a doubt, get the vaccine. They need to watch out for nothing more than what their regular side effects are, because their heart will not be affected by this vaccine.
All right, Dr. Rathi, a similar question to you regarding the vaccine and, those with heart issues. Is it effective and safe for patients with uncontrolled hypertension and heart disease?
Yeah, it is not like that if somebody is having high blood pressure, then he should not take a vaccine. Even if there is a high blood pressure, one has to take a vaccine. Blood pressure is not a contraindication for vaccine. The people, they do ask that my blood pressure is 180 by 100, should I take a vaccine or not? So this is not a contraindication. This is also very important that one should take a proper medication to control their blood pressure. But suppose they are going for a vaccination and their blood pressure is marginally high, that is not a contraindication. They must take vaccine. And as all the panelists, they have stressed upon, vaccination is of paramount importance and everyone should get vaccine.
Right. Dr. Aran, we've talked about, heart patients. If you could tell us about people with diabetes, anything that they need to look out for when they go in for their vaccinations and post-vaccinations, any medication that they need to, adjust when they go in for their vaccine?
Yes. First thing, vaccine does nothing to the diabetes control. Stress related to vaccine, psychological stress, that can sometimes increase your blood sugar. But you just have to behave the same way as you were behaving before the vaccine, in terms of your lifestyle, in terms of your diet, and in terms of your medication. In case you notice some change or associated side effects of vaccine, and that affects your diabetes, then you must consult your doctor for the needful.
Right. Dr. Mehta, now, a lot of the population has already got coronavirus, and we hear all these stories of long COVID. If you could tell us about, the post-recovery treatment for COVID patients, especially here in India.
So there is a definite entity called the long COVID or long haul COVID syndrome. It does not affect all patients who have COVID, and it can affect you at a varying time interval after COVID. Sometimes the most common thing that a patient experiences after recovering from COVID is simple things like fatigue for a couple of weeks, a little persistent cough, some mild breathlessness, a lot of changes in our taste and smell which may linger, headaches, memory and confusion, and some concentration abnormality problems. These are mild and they will pass, but there is something more serious which can happen a couple of months after you've recovered from COVID. This is related to abnormal clotting in your body, which can be in your legs or in your lungs, heart damage. It also leads to lung fibrosis in the long run, and some neurological effects like strokes and seizures. But these things are rare. They are not common. If anyone, even after recovering out of COVID, experiences discomfort or difficulty in breathing or discomfort in their chest, they must approach their physician, because there is something called long COVID, which is after you've recovered, a couple of months later, you develop problems. So it just needs vigilance. We still are learning about this virus. We don't know whether these things will be persistent and permanent, but we must be vigilant about them.
Dr. Rathi, if you could tell us about, in the last year with the fear of coronavirus, it was this new disease, also because of the lockdown, a lot of people put off certain procedures that were required by them because, they were afraid to go to hospitals with the COVID being rampant there. Should people now go ahead and get those operations done?
Yeah, definitely. One should not ignore their disease and symptoms, and if somebody is having any problem which requires medical attention, they must visit hospital. And majority of hospitals, they are operating or they are treating patient in very safe condition. The patients who are getting COVID infection, they are being isolated very well, and all the patients who are getting admission, before admission, we do a COVID-19 test for them. And then only we admit all these patients. So bottom line is very clear. Any patient who is getting any cardiac illness or for that matter any malignancy, they should not delay their procedure. However, if there is an elective procedure, suppose someone has to go for a minor operation like an operation of hernia or hydrocele, and there is no impending indication and there is no complication, then they can wait. Otherwise, if there is any problem, any symptom which warrants you to come to the hospital, please do not ignore, and especially the cardiac symptoms. So my piece of advice will be, please do not ignore your symptoms. COVID, we have to live with this COVID. Vaccination drive is on and we will win this pandemic. Please do not ignore your symptoms and remain healthy.
All right. And Dr. Aran, another question that we get very often from people is whether someone with a history of allergy should go ahead and get the vaccine, or is there any sort of precautions that they need to take?
The only absolute contraindication for a COVID-19 vaccine is a previous history of anaphylaxis or severe allergy to COVID-19 vaccine. It is interesting to know that the allergic reactions do not occur because of the virus in the vaccine. It occurs because of the chemicals which are combined, which work as a vehicle in the vaccine. So one should be knowing to which chemical is he allergic in the past. If that chemical or if that substance is present in the COVID-19 vaccine, then you should avoid. The best thing would be if you have had a history of allergy to anything, serious allergy, you must take an expert's advice in this context. Otherwise, everybody can take a COVID-19 vaccine irrespective of the minor allergies in the past.
All right. Well, thank you for that. And finally, Dr. Mehta, what is the ideal duration, period between the two doses of vaccines? Because recently it was increased for Covishield. If you could tell us a bit about that.
So for Covaxin, it's quite clear. You need to take 2 doses at least 4 weeks apart. And for Covishield, initially it was 4 weeks, but now the recommendations are changing to between 6 and 12 weeks. This has to do with our immunity and the way our body responds to the external agent. And sometimes the second dose, which is like a immune booster dose, works when your body has already developed a certain amount of immunity.
All right. Well, thank you so much, doctors, for taking time out and answering all those questions. And do remember that if you can get the vaccine, if you're eligible, then do go ahead and get it. It's the only way to get out of this pandemic. Thanks so much for watching. Goodbye.